Everybody, this is Steve Kilberg from SKRP Media, continuing our series of interviews. And today we have with us Dr. Steven Shanbom from Shanbom Eye Specialist in Berkley, Michigan. Dr. Shanbom, good morning. How are you?
Good morning, Steve.
Dr. Shanbom, as I said earlier, some of our viewers have reached out to us, and if they're looking to have some cataract surgery or a cataract procedure done in the Berkley, Greater Detroit area, what advice would you give them?
Well, you want to find somebody that you can trust your eyes to. That's the main thing. And you want to find somebody, if you want cataract surgery, that does a lot of cataract surgery, somebody that's experienced in the field. You can go look online. You can look for comments on reviews. You can look at websites to see what patients' experiences have been with those doctors.
Great advice. Again, today's world, people, their first reaction is to kind of go online and do some research. So that's some great advice to our viewers. So tell us a bit about your background. How long have you been practicing? And you focus on cataract surgery. Tell us a little bit more about that.
Well, I've been in practice just under 20 years, and I specialize mostly in cataract and LASIK surgery. We also do general ophthalmology at our practice as well, in regards to glaucoma and retinal diseases, macular degeneration. But our main focus is getting people to be less dependent on glasses through cataract and LASIK surgery.
The continuing of technology, it continues to make our lives, better and safer, so to speak. And that's great that you guys keep up with the advancements and have been doing this for 20-some years. So you clearly know what you guys are doing.
Well, it's very interesting what's going on. Like you said, the technology continues to improve, and what's new in cataract surgery is laser cataract surgery. So when you were talking, say, traditional cataract surgery, which uses ultrasound and manual incisions, laser cataract surgery, many of the steps of cataract surgery are now automated with the laser.
So tell us a little bit more about the laser aspect then.
So laser cataract surgery uses a high-frequency laser called a femtosecond laser, similar to the technology that's used in LASIK surgery. And using this laser, we can create the incisions into the cornea, we can open the capsule of the cataract, we can pre-soften the cataract for a much gentler, safer removal of the cataract.
Wow, again, that's I love to hear the advances in technology, and so that's great to hear that you guys are really up to date with all that. With all that information, and again, your patients are experiencing positive outcomes, which is why you guys have been so successful, being in business as many years as you have. So congratulations to you guys.
Yeah, thank you. Just to expand on that, the other things that are available for cataract patients now are specialty implants that would allow for correction of their astigmatism, implants that would allow a person to see both distance and near, to decrease their dependence on glasses to virtually zero. And combining these technologies, our goal is to try to get somebody as glasses independent as we can.
Wow, that's great. Again, I love to hear stories like this, and again, the fact that your practice has been doing this and is up to date. I think our viewers will be assured to know that you guys are one of the best people in the area. So tell us a little about if a new patient's coming in, or even an existing patient's coming back. Walk us through that experience when they come into your office. Tell us how that goes.
Well, initially, when you make an appointment at the office, you will get a welcome packet sent to your home to give you some ideas of what these new technologies are and what your options are in regards to cataract surgery these days. So when you arrive at the office, you will have some idea of what you're going to be, what we're going to be talking about in regards to the surgery. But when you come into the office, you'll first be greeted by Jody, who will do measurements of the eye. I want to know, even before we do our consultation, do you have astigmatism? How much of a prescription, or how thick are your glasses? And what are your goals? Some people's goal is not to be glasses free. Many people are. So I want to get an idea before we even meet, what we're going to be talking about in regards to your surgery and your experience. So after those measurements are made, they'll take measurement of the vision and the pressure and all the parameters of the eye, and then dilate the pupils. And that's when I'll come into the room and we'll talk about, I'll do an examination, thorough examination of the eyes to give the patient an idea of what I think is going on and what a plan would be for correction.
Wow, again, that is some great information, Dr. Shanbom, where you're clearly doing the consultative approach, you're educating your patients, and I, as an individual, would highly respect that from a doctor. So that's great information for sharing that today. Thank you. So if people want to get in touch with you, what's the best way to find your office and your website and where you guys are located, et cetera?
Well, we do have a website. It's shanbomeyespecialist.com. There's also the lasik is another way to get to my website. Or just to call the office is 248-546-2133.
Okay, great. Well, thank you very much, Dr. Shanbom. This has been, again, very educational, and I think a lot of our viewers in the greater Detroit area are going to find this very, very helpful. Thanks, and have a good day.
Thank you.